After the anatomy unit, you might be thinking, great, now I know a bunch of different anatomical parts, but I am not sure how they all work together. The reproductive system is truly a system where many cycles and processes work together to achieve complex results. Because so many of these cycles and processes start with menstruation, we thought we'd start here too. So getting your period or menstruation, what is it? Put simply, it's when blood and tissue from the uterus comes out of the vagina. It happens about once a month and is a completely normal and healthy process. Most people with a uterus will menstruate, but not everyone does. Trans men and non-binary folks on testosterone won't get their periods while taking hormone replacement therapy, but may restart if they stop taking testosterone. There are also medical conditions that may prevent someone from getting their period. It's not dangerous to not have a period or to have an irregular period, but it could be a symptom of a medical condition, so be sure to bring it up with your doctor so it can be discussed and evaluated. While most of us know menstruation is a thing, we might not know what actually happens during the menstrual cycle. Menstruation is a cyclical process where the body moves through various phases that repeat approximately every 28 days. Each month, the body begins the menstrual cycle with the follicular phase. In this phase, the body releases a hormone that causes the ovaries to start maturing an ovum or an egg. The mature egg contains DNA, and when combined with sperm cells, has the potential to develop into a fetus. The hormones that make the egg mature also make the lining of the uterus become thick and spongy during this time. The uterine lining thickens so that if the egg is fertilized, it has a nice cushy place to land, implant, and possibly develop. This lining is made of tissue and blood, which has lots of nutrients to help a fetus grow should a pregnancy occur. The follicular phase of the menstrual cycle normally lasts about 16 days and directly proceeds into the ovulatory phase. Ovulation begins about halfway through the menstrual cycle when the new hormones tell one of the ovaries to release a mature egg. Once the egg leaves the ovary, it travels through one of the fallopian tubes towards the uterus. Depending on whether a fertilized egg implants or does not, the body releases different hormones. If a fertilized egg implants in the uterus, the body releases hormones to maintain the thick lining, and menstruation ceases until after the person gives birth or has a miscarriage. If the body does not detect a fertilized egg, it will release different hormones that tell the body to shed the thick lining of the uterus. The lining breaks down, and blood, nutrients, and tissue flow out of the body through the vagina, and voila, it's your period. Menstruation typically lasts between 2 to 7 days and can look different for everyone. It's normal to have anything from heavy to light flow, and some may experience fluctuations in levels of period flow throughout menstruation. With the start of bleeding, the entire menstrual cycle begins again. To manage period bleeding, there are several options to explore. Some people use tampons or pads, which are disposable products to absorb and catch blood before being thrown out. These products come in various sizes, thicknesses, and lengths to accommodate different body types and levels of flow. If a tampon or pad feels uncomfortable, try a different size or brand, as one might work better for your body and its needs than another. Both tampons and pads are available for free on the first floor of the Student Health Center near the pharmacy. For non-disposable menstrual products, some people use period underwear which absorbs blood into washable fabric, or menstrual cups which catch blood in a soft, insertable silicone cup that can then be emptied into the toilet. Others choose to free bleed and use nothing at all while on their period. Whatever you choose, make sure it is the most comfortable and accessible option for you. Periods are natural and healthy, and that's great, but for a lot of folks who menstruate, periods are kind of the worst. It's common for people to experience pain and discomfort due to their menstrual cycle. While this pain is manageable for many, it's important to consider that for some, period pain and symptoms can be crippling and cause a monthly disruption in their daily life. Menstrual symptoms should not be belittled or ignored because everyone deserves to be pain-free. If you find that period pain disrupts your daily activities and quality of life, we encourage you to talk to a medical provider to make sure there are no additional medical issues compounding or exacerbating your pain. For mild to moderate period pain, here's some tips that might help with relief. Heat, Heating pads, a water bottle filled with hot water, or a warm bath and shower can help your muscles to relax and relieve pain from cramping. Over-the-counter medication like ibuprofen help to limit inflammation and can give relief from period pain. Exercise. It might be the last thing you want to do on your period, but exercise helps to relieve period pain. Orgasm. Seriously, a vaginal orgasm can trigger your brain to release neurotransmitters such as endorphins and oxytocin. Endorphins can decrease pain and perception. And if you don't have a partner or your partner isn't into period sex, a solo orgasm does the job just as well. But remember, if your period impacts your quality of life, it's a good idea to talk to a medical provider about what you are experiencing. That's the menstrual cycle in a nutshell.